insurance or with healthcare in general?
Yeah. Well, first of all, the Affordable Care Act, which passed 2 years ago, is not fully implemented. And I think that's really difficult, especially in a political environment like this, where in America we like to kick the tires of something before we embrace it, you know, and we haven't had a chance to do that yet fully with healthcare because it's not fully implemented yet, and it's complex and it takes a while to unveil and put it together. We can kick the tires of part of it, and so I've talked about some of those things. The idea that parents don't have to lay awake at night because they have a child who's sick and they can't get coverage for them because the insurance companies used to be able to reject them or just charge something we could never afford. And that doesn't happen anymore because we've outlawed it. And what we'll look forward to more of is these common sense protections against abusive practices of some of the private health insurance companies. They can still turn away adults with pre-existing conditions. Soon that will be outlawed too. They can put caps on how much they pay out for an illness, and that will be abolished at one point or another. And you know, if you haven't gone through it, it may not seem like, you know, what's the difference? But I remember a family from Beloit, Wisconsin, who talked about their dad who ultimately passed away, but he had cancer, and they had insurance, and there was a policy that said the limit is $10,000 for treatment of cancer chemotherapy. That covered one round of chemotherapy treatment, $10,000. They weren't going to walk away from their dad, so they put the second round of treatment on their credit cards. They maxed out all their credit cards. The third round of treatment was required. They took a second mortgage out on their house. Ultimately, they went bankrupt as a family. They lost their house, and ultimately, sadly, also lost their father. Families should not have to go through that to take care of somebody who's ill with their family. And so those sort of protections are in place. In terms of where we still need to go, even when it's fully implemented, and I'm of course being optimistic that the Supreme Court will uphold it because we're having that battle before we even have a political battle about it. But I think that there's more we can do to contain runaway costs. And part of the way we do that is better coordinating healthcare and focusing attention on people with chronic and expensive conditions and helping them keep those costs from exploding by doing as much preventative and early intervention treatment as possible. And I think that the bill that was passed 2 years ago starts that discussion, starts that process, but it doesn't go far enough. So I'd like to see that in the future.